Welcome back to another episode of Life's Ambition Podcast. Today we're joined by someone who has worked in the athletic training industry. She's going to give her input on the challenges and processes of it. Without further ado, Lynn Bigelow. So Lynn, how you doing?
I'm doing great, Drew. How are you doing today?
I'm doing great. I will say it's been raining the past week and, starting to train for a marathon. So trying to get outside and run. I've heard a lot of people say running in the rain is really cool, but there's something where I just feel really sticky, so I don't do it. So I just been on the treadmill. So I'm hoping to kind of get back on it once the rain starts dying down. But what's
Good
new
for
in your
you.
world?
Congratulations. That's an awesome accomplishment. I can't even drive 26.2 miles without getting tired. So go get them, Tiger.
Well, it's a Disney challenge. So I'm gonna go run in Disney, and so there's this thing called like the marathon weekend, and so
Yep, I've heard of it. That's pretty cool.
Yeah. So I'm doing this goofy challenge where you run a half marathon the day before you run the full marathon. And I'm telling myself that if I do this, I'm never going to run again, but we'll see.
I think it's awesome. Congratulations. Like I said,
thanks.
I mean, I'll just be either on my bike or in the car, just passing people like, go get them, been there, done that. So you know what? And make sure you have my contact information for when you get, an ache or a pain or a cramp or, IT band syndrome. We're here to help. So
yeah, well, and that's kind of where I wanted to transition to is like your world. It's all about athletic training. So let's kind of get into it and understand kind of how you got to this point. Because a lot of people have tried to get into the athletic training world and they find it very tough to get into. So I'd love to hear your story.
Yeah, no, appreciate that. So I mean, it's not one that is, I would say, riveting by any stretch of the imagination. I grew up being an athlete. I was always doing some type of sport, and as I grew, I mean, growing up, I think everyone pretty much goes through, 5 or 6 different, what do you want to be when you grow up? I mean, I went from anywhere from a veterinarian to police officer to you name it, right?
Yeah.
Athletic trainer was not at the top of the list, to be quite honest. But I wanted to, I love the fact of being an athlete, wanted to stay healthy. And after high school, and I had sustained a couple of injuries in high school. So I had my first knee surgery when I was a sophomore in high school. Fast forward, 40 plus years, I've had 7 knee surgeries, shoulder surgery, wrist surgery. So I'm pretty sure an orthopedic surgeon has a boat with my name on it somewhere in Lake Michigan. So how I got there was after high school, I received an appointment to the United States Military Academy. As I really didn't know what to expect because, medicine and military, that really wasn't part of the gig. But during my training, I tore my ACL and had my second knee surgery. And I really started thinking about sports medicine at that point because the physical therapists there, the athletic trainers, the physicians were awesome. I mean, you're basically talking about 4,000 young healthy individuals getting ready to serve their country, and they need to be healthy. Like, they need to get on the battlefield. So I really, when I went into the military, I wanted to actually be an FBI agent. I wanted to go military police and then go FBI. So God had a different plan, and that is awesome. So I had left West Point after my second year and went to Arizona State, where I actually found athletic training. And I'm like, I kind of like this. I like the fact of helping individuals at the time of their worst aspect of an injury, seeing it, getting them to the right people, and then rehabbing them afterwards. So you really see the worst of what can happen, and then you help them to become the better versions of their self and getting them returned to function. And that's what I loved. So I became an athletic trainer. I was a student athletic trainer. Then after I graduated Arizona State, I went to the University of Illinois, where they had a master's program in athletic training. So I was there for a year. I got my master's in athletic training. And from there, I started my career with a company called Health South, which is no longer in existence. But for older folks such as myself, most people in the healthcare industry are familiar with Health South. So I was down there in um, Missouri, and I wanted to move back close to home. I'm from the Chicago area, and I happened to stumble across my now ex-husband at the time knew an employee of Athletico and knew the owner, Mark Kaufman, very well. So I decided to reach
Great guy
out
there.
and, right, I mean, reach out, and the old, we didn't have fancy schmancy email or anything like that. It was the good old fashioned snail mail, and hoping and praying for the best. And so I sent my resume, and Mark called me and said, "Hey, you know what? Why don't you come in for an interview?" So I was home for, I think this was the winter of 1996, right after the first of the year, and it was freezing cold. I remember it was bitter cold. And I drove into the city, and I met Mark at the Clark Street office. And I'm just going to shout out to Mark. Mark has the penchant of remembering when and where he interviewed people and how he connected with them. And that was awesome to me. So we met at the Clark Street office, which was our flagship clinic. And I remember just being frozen and going, why do I live in Illinois? So I had a conversation with him. I went over to a couple of clinics, met with the clinic managers. And then as I was trekking back down south to Missouri, back home, by the time that I got home, Mark had left a message on an answering machine. I know these are archaic times and tools that we had back in the day. And he offered me a position with Athletico as an athletic
Wow.
trainer, treating in the clinic, and to me that was awesome. I wasn't familiar with the whole athletic trainer treating in a clinic. I did it with Health South, but the way that I remember Mark sharing with me an article featured in Crane's Business that featured Athletico, and I'm like, this is something different. It was something that I was looking for, and moved back up to Chicago and started March 1st of 1997. I was at our East Bank Club location, and been with the company. It's been an amazing ride. So.
Yeah, no, first, obviously, big shout out to Mark Kaufman. Had him on the show a little while ago. He is so cool with how he basically brought Athletico from the ground up. And I've always had an awe for entrepreneurs, because to take a business from ground zero to become a multi-billion, whatever it is incredibly difficult to do. So shout out to Mark Kaufman for that. But there's a lot of that I want to break down in terms of your story. You mentioned a lot about how you had all these ACL injuries, you just had injuries in general. Do you think that was honestly kind of a calling in itself to just become an athletic trainer? That because with my dad, and when he was in school, he had a lot of really bad hip and groin problems, like he would tweak his groin, or there would just be something that's messed up, and someone offered him to go to a class, and then that's when he got into physical therapy. Do you think that was kind of a calling in a sense of, wow, like my body's just always beat up, I need to learn more about it, and then boom, athletic training kind of came about?
I think so. When I was interviewing physical therapists as a regional director, I typically asked the question, why physical therapy? Like, why do you want to be a physical therapist? And majority of them were like, well, hey, I was an athlete. I sustained an injury. I experienced it. And when you experience something that can be life altering, because many of these could sideline a sports career. And let's face it, I wasn't going on to go play pro softball. Like, that wasn't going to happen. However, I mean, had I gone and stayed in the military, that would have been my military career. And so when you sustain that type of injury, I mean, it can alter it or shorten it. And I think that you become relatable. So when you are treating a patient, you have the ability to relate to them. And that is something that, from a patient perspective, is so important, because you want to have trust right from the get-go with your provider, whether it's an MD, whether it's a nurse, whether it's an athletic trainer. Healthcare is very personal.
Yeah.
And I get it, it's a business, but you can never look past the human element to it. So yes, in answer to your question, 100%. When you're on that side of it and healing, I've experienced the white coat syndrome, where I'm in an office talking to a physician and I leave and I only retain 5% of what the physician said. And so that helps me be a better clinician to help prep patients whom I treated. I'm going to do a little sidebar real quick.
All good.
So funny story about you and your dad. I graduated University of Illinois with my master's degree. It wasn't until 15 years later, as I'm cleaning out my basement, I came across the graduation program. And I'm looking at, the master's, blah, blah, blah. And I flip it over and had undergrads. And whose names do I see? Joe Bresingham and Kevin Quinn, who both ended up working for Athletico. We worked at Athletico at the same time. So It's just, healthcare is a reminder that it is a small world. It really is.
Oh, yeah.
Yeah.
And I would say, what does the client interface look like to you? Because I can only imagine that it's such a big part in your world. Like, how do you connect with others? Because, I had Scott, I know this is maybe not the same, this is definitely not the same profession, but Scott Zellickson, he was an accountant and had him on the show. And he talked a lot about how your relationship goes beyond the workspace, because one, it helps keep them coming back, but also you care for them in a sense as well, because their business revolves around your business. And so I was wondering what the customer interface looks like for yourself, especially when you're on the athletic training side of things. Where is it injury? You talk them with their injury, and then you kind of like start bonding on a personal note. Do you work with them outside of just the office itself, where it's just sending them exercises? Like, what does that look like?
Yeah, I think there's two different pathways. So at the time that I started with Athletico, athletic trainers were treating in the clinic. And so I had the unique opportunity to not only be on the sidelines should an injury occur, so I could see it firsthand, but an injury does occur. I'm calming down the athlete. So you've got to build trust and rapport even before the injury, right? Your athletes have to trust that you have their best interests at heart. And when I got into this profession, I had experienced really bad medicine. And you don't know what bad is until you experience it. And you experience great medicine. And so when I got into medicine, I wanted to make sure that that never happened to anybody else.
Very what do you mean by bad and good medicine?
Yeah, bad medicine, good medicine is communication. Are you doing what's best for the patient, or are you doing what's best for your bottom line? So I've experienced a situation where I literally had an experience with physical therapy where had a knee injury, and I was in, of course, physical therapy clinics at the time were in basements. So like no windows. So I don't know if it was because, you couldn't scream and get out or what have you. So, I was literally put in a room. I had ice and e-stim put on my leg, 20 minutes, didn't talk to anybody. The door was closed. That was it. That was my experience of physical therapy.
Really?
And yes, yep. No interaction with the therapist, nothing like that. So I'm like, there's got to be more, right? I mean, you think of it now as like, oh my gosh, it's so archaic. But at the time, that was probably the norm rather than the exception.
When they say like rub some dirt on it for the expression, that's pretty much what it sounds like.
I'm going to say that I have said that to a few athletes in my time. However, knowing full well that we're talking about a hamstring strain, not necessarily a torn ACL. So I'll just put a caveat on that. Or a physician who again may or may not spend time with me. Like if I'm asking questions and they have a handle on, or their hand on the door handle, and they're ready to walk out the door, wait a minute, I have questions. You told me I just need surgery. Well, why do I need surgery? Right? I mean, all of these things that are going through my mind, and it was years later that I found out that my very first surgery probably wasn't the best course of action at that time. And again, medicine moves pretty quickly. And so I don't begrudge it. I learn from it and basically make sure that, either myself, our teams are up to speed on what's happening in the medical community. Are we doing the research? Are we applying the research appropriately and communicating and building that trust with the patient? Because the patient doesn't know what we know. And so I think that, but they have questions and they're scared. It might have been my 100th ACL that I saw on the football field or the rugby pitch. But to them, it was their first ACL tear. That's a big difference. And so if you don't have that level of empathy and that trust, you're never going to get it. So that building trust is to me one of the most important facets. And then walking through, as an athletic trainer, having the ability of not only identifying the injury, getting them into, at the time, an Athletico facility. So because I was treating, I'm like, hey, come see me tomorrow in the clinic. Let's take a look at you. And then identifying, do they need to see a physician? And if they do, what's the best pathway? Pending insurance, pending where they live, where they work. What is, do they have an existing relationship? All of those things that I want to find out, because I do want to get them to the most appropriate physician for their injury.
Yeah. Like, what does that conversation look like, though? So let's say I come in with an ACL injury. How do you diagnose people without actually being them? Because I've always found that very interesting, how physical therapists and I guess hand physicians and all these other kind of people can kind of just feel around like someone's leg or like their arm or something and just know what's going on. Is it all the studying that you guys have done? And what does that kind of just look like for yourself and how you approach certain situations? And how could other people who are new to the profession approach those kind of situations?
Yeah, no, great questions. I would say from my very first event, new grad, newbie, wet behind the ears, I literally was calling my supervisor for every little thing. I'm like, I don't know, it could be this. Well, it could be a meniscus tear, and it could be this. And she chuckled and she's like, you're gonna get this over time. Like, part of it is experience. You lean on certainly what you've seen, but certainly your special tests, knowing the anatomy, knowing what the joints feel like, understanding the special testing, and really understanding what normal feels like. And I'll never forget a friend of mine, we were talking about a completely different conversation. It had nothing to do with sports medicine, but I think it's relevant. And she said, FBI agents who are being trained on counterfeit money, they never study the counterfeit. They just know the real money. So they can identify the counterfeit right away. And I think that applies to this, is you have to know what normal is for that person. And if you know that, then any deviation, you're like, okay, something's up here.
Yeah.
But that being said, I also have someone, let's say if it's an injury that just occurred, I also want to make sure that I'm not approaching the athlete, and let's say, they've got clearly a broken arm or a broken elbow or something. I'm not running up to them and going, oh my gosh, that's so nasty, right? I mean, that doesn't instill a lot of confidence either. And they're like, whoa, what's going on? You don't want to panic the athlete. So I want to protect them as much as possible, but I also want to not BS them either.
Yeah.
So it's a delicate balance of understanding that. and making sure that they're calm, that they remain calm. It's like, hey, I've got you. We've got this, right?
And I'm sure that's
So
person by person as well. Like some people
100%.
you can 100% push them way
Yep.
harder versus someone else who I'd like to say maybe not many people who are outside athletic teams and stuff may not be pushed as hard. And that's a total generalization. I don't know if it's true, but I feel like athletes who go through a lot, maybe you can push them a little bit harder because they're used to it.
Exactly. It's knowing your team, and that's part of the trust aspect of it. And so when you know that, and you get to know the parents, like, you want to be careful. Choosing words is critical, because I don't want to lead off with like, "Hey, yeah, I just think you just tore your ACL," and be completely wrong. Right? There's nothing faster that will erode that trust than saying something like that. So I want to make sure, and never that, not that I'm going to be 100% sure, but that's why, getting them into a clinic the next day, like, hey, let's look at this. And again, barring that there's no emergency, they don't need to go to the emergency room, right? We're talking, hey, this is cut and dry. So getting them into the clinic the next day and be like, okay, everyone's calm down. We're in a more of a sterile environment where, there's fans not screaming and a coach not breathing down your neck, and the stress of that all. So then it's a conversation of, let's take a look. What are you noticing? What are you feeling? And then I had the ability to leverage my team around me. So the physical therapists that I was working with, or other athletic trainers in the clinic, I'd be like, hey, can you take a look at this? And introducing them so that they're seeing what I'm seeing, or either affirming or saying, no, I think, I think it's this.
Mm-hmm.
So either way, if I feel like they need to go to a physician, then I'm going through like, okay, I definitely think you need to see a physician. And I'm still not going to say like, hey, I think you tore your ACL. I want to make sure, because I don't want to put it in their head, of something that can be completely wrong. So that's what I also offer up. I'm like, hey, I can help get you in. Like, we can be the Disney fast pass and help leverage our physician relationships to get folks in. And many physicians are open to that. They're like, yeah, you know what? You need to get an athlete in, you need to get a patient in, let's go. Like, let's do this. So having 27 years of that and 32 total, that's been awesome.
Yeah. And I guess I love to ask you kind of more of a general question is, what is the difference between you and a physical therapist? Because it sounds like you can diagnose the same things and be able to, I guess, not necessarily like, or I don't want to use the term operate, but work with people and trying to help them, make them feel better. Like, what's the defining line where you send them to the physician?
Yeah, that's a great question. So to be clear, like, physical therapists and athletic trainers, I mean, we don't diagnose. Like, that's not our lane. Usually with diagnose, you need to do like injections or imaging, things like that, which we can't order, in many states. Some states, they might be able to. So it depends on state regulation. But we evaluate. We're basically taking what we see, our special tests, and we're basically the process of elimination. So essentially, between physical therapists and athletic trainers, we have very similar trainings, backgrounds, and courses. And yet there is a difference in our state practice acts, which helps define those roles a little bit more, and also national boards. So I take a certification exam. Also, physical therapists take a licensing exam. And so much of it, there is an overlap, but I would say physical therapists probably have heavier lift on like more of a neuro component, really diving into motor sensory, nervous system type stuff.
Yeah.
Yeah, so I mean, that, again, very similar, yet there's some inherent differences. And ultimately, too, it's what insurances will reimburse for as well. And again, it's different by insurance company. It's different by state. So, yeah.
Interesting. And I guess, like, is your setting different as well, where they might be more in a clinic versus you're working with athletes maybe at a game, or you're traveling around to different places to work with different clients of Athletico? Like, because I know that doesn't Athletico work with like the Blackhawks and all these other kind of organizations as well?
Yes, that would say for athletic trainers, it's mostly what we would call a traditional setting. Traditional setting is you're traveling with teams, you're at a college, you're at a high school, where you're in the historically training room, getting the teams prepped for practice or games, covering those practices, making sure that they have physicals, communicating with their physicians, whether they're primary care physicians or orthopedics, what have you, and also working closely with physical therapists. Um,
Yeah.
and like I said, the unique part of when I started in my career, I was very blessed to have that opportunity to treat in the clinic and work alongside physical therapists so we could bounce ideas off of each other, collaborate, and really, really appreciated that
It makes you
opportunity.
more effective too, because then you're hearing different perspectives to apply in your own practice.
Absolutely, absolutely. So, and again, I've worked alongside some really smart physical therapists, and so that has made me a better practitioner, which has been amazing. And I really have enjoyed that aspect because it was a foundation of a career spanning, 30 years.
Yeah, like who did you travel with?
Yeah, I mean, so when I started, I worked Robert Morris College at the time, which is now Robert Morris University in Chicago. But Athletico
Nice.
had numerous affiliations with, U.S. Soccer. I think probably like at the time was like 15 high schools, and so would go to different high school training rooms and coverages. So we had that nice aspect of it. Rugby was one of my favorite sports to work
Really?
because yeah, I mean they're just tough as nails. I mean
That is not an easy sport.
it is
Holy
not, but it
cow.
is fun to watch. And you want to talk about honing your skills? So during rugby matches, I mean, I would introduce myself to the referee, so he knew who I was. He or she knew who I was. But rugby matches don't stop just because there's an injury. Like I would go out there while they were still playing. The referee and I would
Oh,
make eye
really?
contact. Yes, yes. So we would make eye contact, and if the play was coming towards us, then the referee would blow the whistle and be like, "Okay, injury, timeout." But if not, I mean, I would treat on the pitch while they're still playing. But if I needed to get the individual off the pitch, I'd wave down the referee like, "Hey, we need to, move this individual." But they were tough. I distinctly remember early in my career one individual. He basically walked into we had a tent, we had an Atletico tent, and he'd come over and he basically uh, was moving his own lower leg. And he's like, yeah, he goes, I already have a torn ACL. And he's moving his lower leg and doing a Lockman's on himself. And I'm like, okay, so clearly pain's not a problem for you.
They have
But
so much adrenaline
oh
and
my gosh. And we would have just stories over the years of, a neurosurgeon was playing rugby. And I'm like, you may want to protect your hands. Like that's your livelihood, right? Playing rugby today, have someone's brains in your hands tomorrow. I mean, it was
Ooh.
surreal, but they were tough. Nothing could keep them off the pitch. I appreciated that, but there also needed to be a point of common sense as well. And that's where we came in to say,
How
look,
hard was that to
it is,
get through to them?
yeah, I mean, many times, I mean, these were adults. So they weren't under the age of 18. So they were adults, they were consenting adults. So having those conversations and having conversation with the coach, like, no, you don't understand. Like they really should not play. You're going to do more damage because again, depending on their livelihood, if they were, firemen or paramedics or police officers, whatever, is like, no, you have a career to think about. So
Hmm.
understanding those conversations and again, building trust. I mean, I think I worked rugby for the first 10 years with Atletico and you just get to know them over time. And, when an injury pops up, I'll be like, no, get your butt on the sideline. You're not
Yeah,
going
where
out.
would you travel to with the rugby team?
Yep. So sometimes local to Chicago. Again, I was very fortunate. They had interterritorial tournaments down in Florida. So I had the opportunity to travel down to
Nice.
Florida a few times.
Get some
Uh,
sunshine.
Oh, well, yeah. I mean, definitely was interesting. There was one weekend where it was injury palooza. Just crazy from the get-go. We had one our night game. It was a Saturday night, and it was on the campus of University of South Florida. And we had one of our players who was just running. I mean, it was on a breakaway, and the defender caught up to him and tackled him from behind. Well, his knee drove into the ground, but it dislocated his hip posteriorly.
Oh,
So
man,
yeah,
that's gotta hurt.
so I run out there, and I mean it's 9 o'clock at night. It is Florida in December, so I mean it's cooling off. It was a hot day, so it was like 75 degrees, so it's cooling off. And knew right away, like one of these hips is not looking like the other. So that is where, I waved the referee. Fortunately, the referee, one of them was a general surgeon. The opposing coach was also a physician. So they're trying to relocate the hip. They can't. I mean, this thing is stuck. And we called the ambulance. It took 45 minutes for the ambulance to get there because we were on a college campus on a Saturday night. You can imagine the mayhem that was occurring. And so the ER was completely full and the ambulances weren't available. So we finally get him to the hospital, and he had like fractured the socket pretty much was destroyed. I mean, the socket, and we would never have been able to reduce the hip, just never. And smart enough to know that when you have physicians around you, it's their show. Like at that point, there's nothing that I can do other than to support them. Like, what do you need? How can I help? Type of thing, let them take over. But yeah, I mean, the x-rays, I mean, his socket was obliterated. So he had surgery to fix it. And yeah, it was still one of the craziest games I've ever seen. So
crazy.
Yeah.
To just blow out your hip from just a defender coming behind you.
Yep.
Yeah. I guess this thought kind of came to my mind, and I've heard different things on just different documentaries about how turf has led to more injuries for sport, like soccer and football athletes, than it would be regular grass. Were they on grass or were they on turf? And is that actually a real thing where turf can be harder impact for people, causing more injuries?
Yeah. Drew, thank you for highlighting the technology and my age gap. Thank you for that, because when I was an athletic trainer, there was no such thing as turf, Drew. It was just good old natural grass. So thank you for reminding me how old I am. So in answer to your question, yes, when artificial turf came on the scene, there seemed to have been an increase of ankle injuries and knee injuries, things of that nature. I think that is pretty much kind of leveled out over time. And again, I mean, I think the research at the time was showing a higher incidence, but was it because it's the shiny new toy and everyone's paying attention to it, versus you're still playing football, you're still playing a collision sport, like injuries are going to happen.
Yeah.
So, but yeah, so this was natural grass that these injuries occurred on. But I mean, it's always a good consideration and point. And I think there's still, anytime that you're changing a dynamic like turf or any protective equipment, there's going to be a ton of research following it to track. Like, are we seeing a decrease in incident of injury? Are we seeing an increase, or is it stagnant? What does that look like? And I think you're even seeing now today with the NFL. Now they have these concussion caps on their helmet, because there is that concussion and CTE where it's like we know that there's a higher not a higher incident, but there's more likelihood of sustaining a concussion in a high collision sport. And football and rugby are those collision sports.
Yeah, and I guess what is probably, in all of your years working as an athletic trainer, what's probably the biggest difference that you've seen in terms of the technology aspect that's been way improved, and one of helping athletes that are injured, or just even in the future of where you're thinking athletic training is going? Because like you said, medicine's moving extremely fast. Yeah. And so I was wondering what you have noticed has been probably one of the biggest positives that you've seen in terms of, I know you said maybe not diagnosing people, but helping people?
Yeah.
And then where do you kind of see it still going?
Yeah, I think so for the profession of athletic training, I've seen, number one, there's awareness, there's a heightened awareness for the need of athletic trainers at every high school, period. And there has been sweeping legislation across the country, it varies from state to state, where many state Congress has basically said, hey, we need to mandate that there's an athletic trainer at high school football, because of the incidents of head injuries and potential, there's been deaths. Now, again, would those have been if an athletic trainer was there or not? Hard to say. I mean, you can't roll back the time, but it definitely is creating awareness. So I think that to me shows that people are paying attention, that sports are inherently, when you step on the field, like, there is a chance that you're going to get hurt. That's the reality of it.
Yeah.
So I think that's number one. I think protective, especially for the collision sports, football in particular, enhanced protective gear. That goes to the helmet. They have concussion caps. I think the padding, the coverage of the padding is better. Tackling technique is better. There's been discussion between rugby and football to say, rugby, you still have an incidence of concussion, but is football higher? And is that because football players have protection and they just feel like, they're Superman and can lead with their head? Whereas rugby, you lead with your head, you're going to get smashed. I mean,
Oh, yeah.
so the tackling techniques, right? I mean, rugby players don't have that protective gear, so they have to pay attention as to how they tackle. So I think there's
Those guys have like nothing.
Right. There's conversation ongoing there. But I think protective equipment, same thing with soccer. I think male soccer have those protective caps as well. So I think protective equipment has also helped. Athletic trainers being on site, and then I think just access to healthcare has also improved. And
Yeah.
the quicker that we can get athletes and folks into the system, I think it's better for everybody, because the earlier that you can get it diagnosed, evaluated, and treatment started, it just speeds up the healing.
Yeah, I 100% agree with what you're saying there, because we had an athletic trainer that it wasn't my freshman or sophomore year, but my junior, senior, there was this guy named Dylan who would always be on site for our hockey games. And, growing up, I could see a lot of people trying to toughen out what they're dealing with, whether that's hip, groin. Another common injury that was like your AC joint was another big one for hockey. But with having the athletic trainer there just those last 2 years for college for me, the honest reaction of being open with how you're feeling versus trying to just always toughen out and get back out there, I'd say is immensely improved. And it's honestly probably helping people in the long run of, like you said, if an elect trainer's there, they're able to address things faster. And one, you just feel safer. Like before the games, he would always say, like, does anyone need anything? After the games, it would always be, does anyone need ice? So being able to attend, like you said, probably limits the long-term damage. But I also think it's a mental component too of you don't have to continuously toughen out because you don't feel like anyone's there to help you. There's people on site now to be able to handle these kind of things.
Absolutely. And it's not just the physical aspect of it, it's also the mental aspect of it. When, experiencing an injury, now you're separated from your team, right? So now you're down because you do have an injury. Now you've lost your social circle. And so that can have a spiraling effect as well. And when growing up in high school playing sports, we didn't have an athletic trainer. I mean, we were relying on the athletic director, the coaches, and I'm like, and sustaining a knee injury, my mom and I were left to our own, my mom was left to her own defenses to figure it out. And that was challenging, to navigate and like who to go to. And you're getting all of these, different inputs, and you're like, what's true, who's good, and some of it's trial and error. So that to me is, having experienced that, I really don't want parents or folks to experience that, like, who do I go to? Like, I want to be that stopgap and say, yes, here's 100% recommend. This is why. This has been my experience, and that matters. And that's why it's so important for me to meet physicians across Chicagoland and elsewhere, because I really want to understand how they operate, how, their personalities, their approaches to treatment, evaluations. Again, it makes me better, but I can also see them in action as well.
There's 100% a continuing education about this piece. And I know a common thing is like this field has always kept growing. And I guess, do you have to always certify yourself as an athletic trainer every so many years? Or do you have to do like classes or hours?
We do. Every 2 years, I think it's something like, I don't know, 60, 80 hours of continuing education. And that can be various. It could be in person, that could be online, if you will. And that's been, I still have my certification, so I still do it because maybe one day I'll get back on the pitch or, find out that injury and I'm like, well, maybe not. Maybe you shouldn't have me out there. Because I don't, someone gets hurt, I run out there and I injure myself. I'm like, oh, not only am I a client, I'm also the owner. But yeah, I mean, I think it's good because you're keeping up with relevancy of new research, new techniques, new medicines, and that helps us all become better practitioners so we can identify the appropriate injury faster and get that individual into the appropriate hands.
Yeah, and I guess, you know, you had the great experience at Athletic Co. For people trying to get into the space, where are like some of the big upcoming things? Like I've heard it's very hard to get to a professional team because everyone wants to do that. But are there a lot of agencies like Athletic Co? Obviously there's like ATI and all these other physical therapy places. Do they hire athletic trainers, or what is kind of the scene looking like nowadays?
Yeah, I mean, it's an interesting point. I think when COVID hit, it really shook healthcare quite a bit, and I would say athletic trainers took a hit because there's no school, there's no sports going on, and so what are athletic trainers doing? And so I think that woke up our national board a little bit to say, hey, how do we stay? What can we be doing? Because we are an allied health professional. Where do we fit in? And part of it is ongoing conversations with insurance companies to say, hey, we have the training, we have the ability. Are we going to be facing a healthcare shortage of physicians, nurses, physical therapists? Like, we can fit that niche. We have an opportunity to do so. So I think our national board is looking into those and thinking very much forward onto that. So I think that is definitely a possibility. But I think from a schooling perspective, there are numerous programs across the country that have national certifications to become, an athletic, that you can enter into going into being an athletic trainer. And I think it also depends on being really clear what you want to do. And when I chose to be an athletic trainer, what I was saying yes to is evenings, weekends, holidays. Because when do sports occur?
All the
Evenings,
time.
weekends, holidays, right? I mean,
Yep.
who doesn't love watching the triple header football on Thanksgiving Day? You're watching people who are working. And so I have candid conversations with individuals who are interested in trying to figure out, like, okay, do I go physical therapy? Do I go athletic training? Do I become a PA? Do I become an MD? I ask the basic question: what is it that you want to do? What is your expectation? Because here's reality. The reality check is, you want to be an athletic trainer, expect to work evenings and weekends and holidays, depending on your scenario, right? If you're in a college or high school, you're definitely going to be doing that. Professional sports, I knew in college, I did not want to go professional sports. Like that was not my dream job. My job was I wanted to work in a clinic. I wanted to not only see the injury from when it started, but I wanted to rehab that individual from start to finish, from the moment of injury back on the field. Like that
Mm-hmm.
was what I wanted, and that's what I, through the help with Mark Kaufman of what was created for me. So again, looking back on a career, I've been extremely blessed for that. But anyone interested, I think they really need to ask the question, and this is for any profession. This just isn't for athletic training or physical therapy. You have to you have to understand what are the parameters by which those professions are operating. What are the hours? What's the expectation? What are the skill sets? What are the necessary things? Are there additional certifications that you have to keep up? Um, what does that look like? Because if you want to have a family, how does that impact it? Is there going to be travel involved? How does that impact? I mean, look at baseball. Baseball, I mean, it's 162 games. Those athletic trainers and players are traveling 2/3 of the year.
Yeah, all the time.
Right? And I mean, how do you have, kudos to those that have an awesome balance of life at home. I think it's awesome. Hard to do.
Mm-hmm.
But yet I know that it can be done. It's just what are you committed to doing?
Yeah, so I'm gonna leave you with this question is with all these things to think about for young people getting into the profession, what makes you want to keep coming back to it? Like, why be an athletic trainer? Why was it so appealing to you? And with all the years you're missing holidays, like you said, you're working weekends. What drives you to come back?
Yeah, I think for me, I was fortunate that I didn't have a traditional athletic training career. I started out as, again, wanting to help people get them back to function. And through that, I had the ability to grow in my career and go through leadership training and become a leader. I was, manager of athletic training services. Then I, oversaw our athletic training services for the company. Then I went on the operations side. I became a facility manager of a PT clinic, and then I became regional director. So my pathway for athletic training is vastly different than I would say from most athletic trainers out there. And for that, I look back at my career, and God has had His hand on it, and I'm just truly thankful and blessed. And certainly, I know, kudos to Mark. I can't thank him enough for the opportunity, because that's what it is. It's creating opportunity, but you also have to put in the work.
Yeah.
So what brings it back, I'll finish with this, is a good friend of mine at church had knee surgery last week, and she literally lives right down the street from one of our facilities. Yet her insurance is a little restrictive, meaning that she needs to have a referral from her primary care. And just couldn't get it. I mean, the primary care was like, nope, I want you to come to I want you to come here. I want you to come to this facility. Well, that facility was literally an hour and 15 minutes away, including traffic. And I'm like, that, you can't drive because it's your right knee.
Yeah, it's
You're putting
crazy.
yourself at risk. You're putting other drivers at risk. And so coaching her on things that she can say back to the physician, because to me, that is when you start redirecting folks for the betterment of, money or to an organization. I think you have to look back at it and go, is this in the best interest of the patient? And lo and behold, and she's tenacious. God love her, she's tenacious. So she basically went back to her doctor and said, these are the things that you're jeopardizing me. Do. Her words, not mine. And we were able to get the referral.
Nice.
And again, that's a win, right? I mean, we're literally 3 minutes from her house. So to me, that is still fighting the fight and being an advocate for patients. even early in my career, even if a patient could not come to Athletico, I still wanted the best for them.
Mm-hmm.
I still helped guide them to the best either physician or therapy place, even if it meant not coming to us. So I hope Mark doesn't listen to this portion of the podcast. Even if he is listening, I don't know. But I think that when you are helping someone, even if it doesn't help your organization, I can't think of anything more rewarding than that. And that is the why. That's the why.
Awesome.
Yeah.
You know, I think that's absolutely great. Is the acts of service is very much a theme of your guys' world. And so when you help someone, it's very rewarding in a sense. And so I think that's absolutely awesome that you get to do that for others, even for people who aren't in the Athletico company. It's outside of that too. So I can't thank you enough for joining the show today, Lynn. And I think you do amazing work. And I can't wait to learn more about it at some point.
Awesome. Drew, thank you so much for having me. Like I said, I'm pretty sure your parents twisted your arm, but I hope your viewership goes up, not down, after this podcast. So, but no, I really enjoy the questions, the conversation. You're an amazing host, so greatly appreciate the time. And looking forward to maybe part 2 when we actually, dive into another topic. So appreciate it.
Thanks, Lynn.
All right. Thanks, Drew. See ya.
Hey everyone, want to take a quick second and say thank you to whoever listened to the episode today. I really do appreciate it and it means a lot. If you did like the episode, make sure to give it a like or 5-star rating depending on what platform you are listening to. And if you really want to support the show, check out our website or Patreon link below. Thank you, and I'll catch you in the next episode.